Head injury, an overview. Primary brain injury and head injuries can be categorized as either focal, such as contusion or hematoma, or diffuse, specifically diffuse axonal injury, DAI. DAI occurs due to the mechanical shearing of axons during deceleration, resulting in their disruption and tearing. Intracranial hematomas can be classified as extradural, subdural, or intracerebral. Contusions may occur either adjacent to the site of impact, CU, or on the opposite side, contra-CU. Secondary brain injury can manifest in various ways, including cerebral edema, ischemia, infection. Trauma disrupts the brain's normal autoregulatory processes, making it more vulnerable to changes in blood flow and hypoxia. The Cushing's reflex, characterized by hypertension and bradycardia, is often a late occurrence and typically indicates a preterminal event. Extradural, epidural, hematoma. Extradural hematoma refers to bleeding between the dura mater and the skull. This type of hematoma is commonly caused by acceleration-deceleration trauma or a blow to the side of the head. The majority of extradural hematomas occur in the temporal region, where skull fractures result in the rupture of the middle meningeal artery. Features include raised intracranial pressure and, in some cases, a lucid interval followed by unconsciousness, which is a characteristic pattern for epidural hemorrhage. On CT scan, we get biconvex or lens-shaped hemorrhage. The management involves creating a burr hole over the terion to allow the escape of further bleeding, followed by craniotomy for hematoma evacuation. Subdural hematoma. Subdural hematoma refers to bleeding into the outermost meningeal layer. It commonly occurs around the frontal and parietal lobes. Risk factors for subdural hematomas include old age, alcoholism, and anticoagulation. Symptoms of subdural hematomas have a slower onset compared to epidural hematomas and may include fluctuating levels of consciousness, intellectual slowing, sleepiness, headaches. On CT scan, we get concavo-convex or crescentic hemorrhage between the dura and arachnoid. Subarachnoid hemorrhage. Subarachnoid hemorrhage typically presents as a sudden occipital headache. It usually occurs spontaneously due to a ruptured cerebral aneurysm but can also be seen in association with other injuries in traumatic brain injury patients. Investigations. Immediate CT head imaging is recommended in the following scenarios: Glasgow Coma Scale, GCS, score less than 13 on initial assessment, GCS score less than 15 at 2 hours post-injury. Suspected open or depressed skull fracture, post-traumatic seizure, focal neurological deficit, more than one episode of vomiting. CT head scan within 8 hours of the head injury. For adults with any of the following risk factors and who have experienced some loss of consciousness or amnesia since the injury, immediate CT head scan is recommended. Age 65 years or older. Any history of bleeding or clotting disorders. More than 30 minutes retrograde amnesia of events immediately before the head injury. Thank you for watching. Don't forget to like and subscribe to the channel. See you in the next video.